It's a project that's expected to impact both Erie's economy and the future of healthcare in the region. UPMC Hammett breaking ground to expand patient care. Ron Hilliard now in the studio with more on the development. Ron, this is pretty impressive.
This is impressive, and they're moving on along. You might have seen some of the progression of that work, the demolition of the previous building that stood at that same site, but UPMC Hammett is now calling the construction of the new medical tower the largest project in the hospital's 135-year history. There's a large pit where the UPMC Hammett Professional Building once stood. After months of dismantling the 8-story building, it was brought down in July. Soon to rise in its place is the new $111 million UPMC Hammett Patient Care Tower.
Having a new state-of-the-art building where we can provide all of the critical care and intensive care services for us is huge.
UPMC Hammett and community members celebrated the development with a ceremonial groundbreaking Friday morning. The hospital's president, David Gibbons, says the new 7-story tower will increase the number of ICU beds from 40 to 64 and expand other services like radiology.
We're seeing more and more patients coming to us from the region as well as from Erie itself, and we needed to expand our capacity.
According to Gibbons, since UPMC became affiliated with Hammett in 2011, they've hired about 600 physicians in Erie, and the expansion could make room for another 100 employees. In the meantime, the construction project is creating work for hundreds of people.
That will involve local contractors, engineers, architects, and other design professionals.
Upon completion of this project in late 2020, UPMC Hammett will have invested more than $400 million over the past 7 years.
And it's not over. We'll continue to invest in Erie as we watch the growth and expansion of UPMC Hammett and our subsidiaries.
Construction is expected to wrap up in late 2020, and the building is expected to be ready for patients in early 2021. Jill?
Thank you, Ron. You can